to the Colorado Health Symposium's first interactive debate. The resolution is resolved. That's how you always say this. You've got to have resolved and then a colon. Obamacare gives the federal government too much control over Americans' health care.
On our side of the House, we feel that the road that we should take is one that complies with American values, that also fits in with American attitudes to who should have ultimate power over fundamental decisions of their life, particularly obviously with regard to health care. And that also that road should be in line with our Constitution and with the way we as Americans feel that our democracy should function. And it's our contention that this legislation violates those critical elements of what the right road should be.
What you have is this dilemma, is if you want universal health care, what are the preconditions of having universal health care? Well, I think one of them is you got to get everybody in the system with a stake in the system and subject to the same rules.
Your relationship with your federal government is changed forever because we're not just talking about health insurance. We're talking about the federal government saying to you, if you don't buy this other product we want you to buy, we're going to punish you. Now, how do they get you to do it today? They give you an economic incentive. They say, if you buy a house, we'll give you a tax deduction, mortgage deduction. If you buy solar panels, we'll give you a tax credit. If this power is countenanced by the federal government, your future is, if you don't buy solar panels, we're going to punish you. If you don't buy the fuel-efficient car we want you to buy, and oh, by the way, General Motors, our government-owned car manufacturer, is the only one that makes this particular car, we're going to punish you. If this power is countenanced, the federal government has control over your individual economic decision-making.
I'll bet you every doctor and every hospital executive in this room would like to see the federal government exert some control over malpractice awards. Guess what? Obamacare, zero. Zilch. Nada. Nothing. There is no control for the federal government over malpractice. You got that? That's not too much federal control. It's too little. And then the exchanges that my colleague Dick Lamm talked about. You know, at first, the House passed a bill, and many people in Washington, and I, too, felt the right way to set up these insurance exchanges was for the federal government to control it, to set up a single national exchange where everybody had the same menu of plans and prices. And here's what happened. This very articulate, well-respected, persuasive analyst in Washington, D.C., went to Congress and said, no, don't give that to the federal government. The state should run the exchanges. And that guy was so persuasive. I have his name. Yeah, what's his name? Stuart Butler of the Heritage Foundation is the guy. And he convinced Congress, and they took that power away.
I'm reminded of the Declaration of Independence. One of the indictments against George III was that he has erected a multitude of new offices and sent hither swarms of officers to harass our people and eat out their substance. I think that pretty much sums up Obamacare. But there is a better road one can go in terms of how to approach this issue of complexity. And that is for the national government to set the broad goals, to deal with the things that only the national government can do, fixing the tax system, fixing the basic budgets of the system, and allow the states greater opportunity and empower them to make the kinds of changes and to try out things to see which is the best way of achieving the goals that we actually agree on.
It came down through Mitt Romney, who, by the way, said, quote, in 2006 anyway, repudiated in 2008, but nevertheless, he said it in 2006. Some of my libertarian friends balk at what looks like an individual mandate. But remember, he said, someone has to pay for the health care that must be provided. Either the individual pays or taxpayers pay. A free ride on the government is not libertarian. So there really was an attempt to bridge this gap. Maybe this was a mistake, but it was an attempt to to maximize the amount of jurisdiction and authority that is given to private insurance companies, the consumer, and the states.
Could they have done it constitutionally? You bet. They could have given you a tax incentive. That would have been too expensive. They could have given you a tax credit for anything you spend, some great tax incentive. They also could have done, and everybody for the most part thought they were going to do it, the states are not strapped with enumerated powers. That's why Romney said the state should mandate health insurance. How could they have done that? The way they do everything else, well known to Governor Lamm. They say, we'll give you your federal tax dollars back if you pass laws in your state doing what we want you to do. If you want your federal highway dollars back, you got to pass a primary seatbelt law. You got to put helmets on motorcyclists, and you have to have a DUI standard of 0.08. They could have said, if you want Medicaid, of which we'll pay 90%, you got to make your citizens buy health insurance.
There are a lot of mandates in American life. As General Suthers knows, it's against the law anywhere in Colorado, even Boulder, to walk down the street naked. That's a mandate to buy clothes. It's illegal to hike in Rocky Mountain National Park naked. That's a federal mandate to buy a product. There's a mandate to buy nutritional food for your kids. There are lots of mandates, and they all have one thing in common. I'll set it forth in 2 words: personal responsibility. Look, if you want to walk down the street naked, you want to feed your kids dog food, you want to ride your motorcycle without health insurance, fine. Go live on an island somewhere. But if you want to live in a responsible civic community like Colorado, doggone it, show some responsibility and don't impose your selfishness on me.
But the fact of the matter is, we have a unique constitutional system in our country. And as Stuart said, we have to respect our legal traditions, our constitutional traditions, and our American traditions. We're not Europe. We can't have the federal government reaching out and telling you you've got to buy a product. And Stuart, by the way, it's the city of Boulder that tells you you've got to put clothes on. It's not the federal government.
For the last 80 years, we've heard this same song. We've heard the fact that any kind of regulation in the economy or the Commerce Clause was too much. I mean, this is a pattern. This is a pattern that has gone on down the years. And so whether it's a living constitution or whether it's sort of where it was set back in 1789.
When I was 23 years old and started on a good job in the career of my choice, you know what happened? The federal government mandated that I quit my job, leave my career, and join the armed forces of the United States because we were fighting in Vietnam. And I did it, and the government then mandated that I become an officer, and if you're an officer, you don't get a uniform allowance. So the federal government mandated that I buy an entire wardrobe of naval uniforms.
This mandate goes well beyond anything that can be reasonably supported, let alone from a constitutional point of view, but from a fairness point of view. It will lead to millions of Americans not being able to afford coverage that they don't actually require and choose. We don't require federal employees to have insurance under the federal employee system. There is no mandate. There is no mandate as to what they have to have in their health care insurance, except very tiny little things that were put in. But the basic stuff is not mandated. I'm saying if a mandate is not fair and just for members of Congress and federal employees, it is not fair and just for the rest of us.
And just to remind you all, the winner will be determined by the team that changes the most minds in their direction. So it's not who gets the absolute most votes, it's who changes the most minds. So let's see what you have to say now that the debate has happened. So once again, resolved, Obamacare gives the federal government too much control over Americans' health care. And it looks as though by almost a 3-to-1 margin, you all oppose the resolution, with 57 of you supporting it and 15 undecided. So let's see how that compares to the first one. So Elena, are you ready?
Yeah.
Okay, let's see how that goes. Okay, oh my goodness, it is very close. It looks like there was a change of +9 for opposing the resolution and plus, plus 8 for supporting the resolution.
A standing ovation.